Hello. Hi, how is everyone today? This is Dr. Chafel. So we're back for another episode today. So we're going to be inviting Dr. Umar um, today. I'm sure everyone must have seen everything I've been doing. Okay, so I'm going to invite Dr. Let me go ahead and debug. So while we wait before he joins, yeah, I've invited him. Uh, let's make sure he's aware. Hello.
Doc-
Finally.
Hello, Dr. Shefu. How are you?
I'm good, Umar.
Can you, yeah. So,
Can you hear
can you
me?
hear me clearly?
Yes, I can hear you clearly. I can hear you. So anytime I can't hear you, I'm gonna do this way. I can't hear you.
Okay, very good. That
And
works.
anytime a call
Forgive
comes
me.
into your phone, it's gonna
This is my
interrupt
first
the
time.
connection.
Okay, this is my first time of doing this. So, um,
I know.
take that into account. Let's
I
hope it
know.
works
I
out.
know. And also a couple of things. Anytime I can't hear you, I'll do this way. And
Okay.
anytime a call comes into your phone, it's gonna disrupt the connection. So just in case.
Okay.
Okay.
I will
Okay.
take that.
Anytime you freeze and we get connected back, I'm gonna let you know that you were frozen and you can repeat what you just said. So it's as easy as that.
That works. How have
I
you been?
promise I'm good. And you? You've been traveling, you've
Good.
been busy.
Well, actually, yes. I'm actually out of the country right now, but you see, I'm in a hotel room.
Hmm.
But that works. Let's just hope the reception behaves and we can do this.
Hopefully, and I'll try to keep to time, so I won't take some of your time. This is the most requested. Told that you wanted to move it. I'm like, no, no, we are keeping it. We are keeping it for
Sometimes,
today at the
sometimes,
time.
sometimes it works. It works out better when it's spontaneous and on the go. So let's do
That's
it.
right. That's right. That's right. That's right. I don't want to. I want to do a lot of introduction about you. I want to know, like, I want my audience to know who I'm talking to today because they just said Dr. Umar, and I've written so much about you on my Instagram. But they're like, who is this Dr. Umar? She keeps,
Referring to.
they want to know about you. So who is Dr. Umar?
Great.
But I'm going to ask you more questions about you. But I just want them to hear it from the horse's mouth who you are.
Well, this is me, Dr. Umar. I'm a
Yeah.
board certified dermatologist here in Los Angeles, specializing in complex hair loss, keloids, and scarring conditions. Um, it all started because I was frustrated by the limitations
Hmm.
of conventional treatments. I developed innovations like the U-Graft Zeus, the
Hmm.
only all-purpose FUE device that works on all hair types, including textured and body hair. I also invented the Athena Suture Guard for surgically treating severe scarring conditions. I've pioneered techniques for cases once thought to be untreatable in that
Hmm.
arena. And currently, I'm leading research aimed at uncovering the root causes of hair loss that I expect will fundamentally change what we know of hair loss and how we treat it. So we can treat it better and even prevent it. And I believe that in due course, things like severe hair loss will be a thing of the past. We live in a very exciting era, and I'm glad to be contributing to the science
Awesome.
in the field.
Awesome. You said, but I just want to pick up on a few things that I want you to kind of emphasize on there. You said complex loss or you said complex hair loss.
Yes.
Can you hear me?
Complex hair
Yes.
loss
What do you mean
condition.
by complex hair
Okay,
condition?
so
Yeah.
when I got into the field at that point, say when we talk about surgery, let's say surgical restoration of hair, we were just beginning to enter the realm of FUE, which is minimally invasive. It's considered the way of the future. But at that point, there were a huge demographic that was left out,
Left out.
primarily people of African descent, Black people with
Mm.
curly hair were not good
Curly
candidates
hair.
because of the limitation of the technology of that time. Also, if you are severely bald, too bad, you're out of luck because the techniques
Mm.
of the day relied on head hair, which normally means if you're very severely bald, you don't have a chance. So
That's right.
that, for instance, on the surgical aspect, you understand. And with the UGRAV Zeus, which is the first all-purpose device that
Mm.
basically literally takes out the even the curly hair on its own, body hair and all that is now not a challenge anymore. So that worked out well, surgically speaking. But right now, one other area that is very challenging is the arena of scarring alopecia, scarring hair loss. So that's non-surgical, although aspect of it is surgical. Uh, but that's where my research is involved right now. We're trying to get to the root cause of it so that we can develop more effective management therapeutics for it. And we're on a good track to achieving that because the current treatments right now are not uniformly effective. Our
Mm.
understanding of the condition, even the classification of scarring alopecias, we all know it's very faulty. And that's
Very
the reason.
faulty.
Yeah. So currently, the idea is to find a root cause that explains all the scarring alopecias because they're all related. And then if we can treat that root cause, then it all falls like dominoes at the point. So that's really what I'm working on right now. So that's in terms of hair
What you're
loss
working.
complexities. You understand if you do
Got
hair
it.
loss,
Got it.
with hair loss, as dermatologists, a patient walks in with scarring alopecia, usually we develop tachycardia because we don't know what to do with these patients.
Yes.
So,
Yes.
in my practice right now, I'm
That's
looking
right.
for them. I actually look forward to those patients coming in because we think we
Just
can help
carrying
them.
on. Yeah. Yeah. I get almost like 3 requests every day, emails every day. My
Yeah.
doctor always there. What do I do? So you're glad you're doing that. Like, you're doing more research into that, so that we can help more patients. Can you hear me?
Yes, I can hear you.
So now my question, so it's not really my question to you now. So you're trying to tell me that so everyone can be a candidate for hair transplants, no matter the
Well, generally speaking, yes. Obviously, there are exceptions. In medicine, you can't generalize everything. Definitely,
yeah,
there are people that are not
yes,
candidates
okay,
for hair transplants. But I'm talking about the group that used to be excluded just because of their skin type, hair type. That type of exclusion or that type of disqualification is no longer the case. But we still have conditions that are beyond hair transplants. And a huge part of my consultation is telling patients, no, you're not a good candidate, or wait, we have different things for you to do. Not everybody requires surgery, but that's how it works.
okay. Thank you for that. So I just want to make sure I showcase your work, everything you do. So you featured on Dr. Pimple Popper's show. I wanted to talk about how was that experience for you?
Well, it was a great experience. Sandra Lee is now a friend. She's a friend of mine and a
Yeah.
colleague. Um, I admire what she's doing, bringing what we do in dermatology to the world, because a lot of what we do as dermatologists is not known
Yes.
to the world. And what Sandra has succeeded in doing in her platform is to make the world interested in the field of dermatology. So, yeah, we do collaborate on
Mhm.
some cases, especially the ones that touch on my areas of specialty, acne keloidalis nucleae, folliculitis decalvans, dissecting cellulitis, and keloids. So I've not talked about keloids, but you know that keloid is one of the things, again, that nobody wants to touch. My work, the work I've been doing on keloid, has resulted in very innovative, out-of-the-box techniques that makes it possible for me to treat keloids without, you know, in most instances, very successfully, not without recurrence. And my next phase of research, and we're already achieving quite good success, is doing keloids without necessarily going for radiation therapy, okay, and without relying heavily on steroids. So we have
Steroids.
really some very cutting edge methods that I've been working on that appear to be very successful. And we think that it will contribute heavily to the future of keloid treatments. So, for instance, I featured one of the cases we treated with Sandra. It's a keloid case, a patient that has had surgeries 5 times, plastic surgery with radiation, and failed, and we succeeded. And the same thing with acne keloidalis nucleus. So we continue to contribute. I've started my own docu-series. It's going to be released very soon. We've had, that will showcase some of these cases that we're doing in my practice. And I congratulate you, by the way, for your podcast. I
Thank you.
don't know if you noticed, we've started a podcast too. My podcast is
Yes,
called
I did.
the Broadcast.
The broadcast.
So yeah, again, that
I like the way that you're very proactive in hair loss and everything about hair loss. I just like the way you're very proactive. You're into
yes.
research, treatments. You're very, you know, knowledgeable. Like every time we ask you a question, you already know what to do. You start, okay, this is what you need to do. I just like that about you. I was like, I need to talk to you. I need to get you on this show. I need to talk to you. So I'm so happy, like glad talking to you today. So your clinic is called Dr. U Hair and Skin Clinic. So now
Correct.
today we're just talking about hair and hair loss and all that. So what's the percentage of hair loss patients do you see in your clinic?
I would say 60 to 80, 60 to 70%. Well, maybe even 80%, because
Oh wow.
yeah. So a good part of my practice is dedicated to hair loss. Of
Mm,
those 80%, I would say half of them are your typical hair transplant candidates or type of patients with just ordinary androgenetic alopecia.
mhm.
Uh, a lot of my cases are usually patients with complex situations. So I don't get the usual, I'm just bald and I need a hair
I'm
transplant kind
just
of patient.
balding. Got it.
In
Mm.
my practice, when we see that, we celebrate because it doesn't happen. Usually, my patients are patients that have either they're just so bald, too bald that nobody wants to touch them. They come to me because this is one of my specialties, or they've had several transplants that have failed and they have no donor, and that kind of situation. That's my practice. That's what I see. So my
Okay.
population is very skewed. Those kind of
Mm,
cases I see. And
got it.
then the rest are patients with scarring alopecia. Again, those ones have tried usually the usual steroids and all that has failed, and
Mm-hmm.
they're coming for
Mm-hmm.
something else. So we try to help them. A lot of the techniques that I have to deploy are innovative, just out of the box thinking that presents a different solution from what the patient has tried and failed previously. So that's what I do, and it's exciting.
So I'm going to ask you two questions. I'm going to put it this way. What is the most common advice you give to people dealing with hair loss?
Well, my advice to people dealing with hair loss is to, uh, first of all, get a proper diagnosis, right?
Mm-hmm.
So it's very important because, patients these days just will go to the internet and diagnose
Yeah.
themselves and start treating themselves. So the first thing
Thank
is
you.
to really identify what the problem is. Your hair
That's
loss
right.
might not just be genetic, it may not just be
Mm-hmm.
hormonal. Now
Hormonal.
we're discovering that even the so-called hormonal hair loss, a lot of them are complicated by certain inflammatory conditions, which is even similar to scarring alopecia. So not all of them should just go for hair transplants right away. So get proper diagnosis, see a specialist, somebody that can actually examine you with a trichoscope, and determine what type of baldness you have, so they can actually formulate an effective treatment that works for your condition specifically. So that's it.
Okay.
One, and two, start early. Don't wait until it's too late, because
Too late.
when you wait long, often you have complications like inflammation and scarring that makes it a little bit more complicated. And it might be more difficult to reverse what has already been lost. It's easier to retain what you already have than
I
that.
think was
So that's my advice.
okay.
And once you start, if you have to start anything tentatively, if it's not working for you, you're not seeing effective results, then seek help. Right.
Secure. That's right. Now, what's the most common myth you've seen on the internet that about hair loss?
Well, one of the common myths that people have, which it's really very rampant, is that hair loss comes from the mother's side. So
Okay.
most,
Okay.
it's genetic, and they go, no, it's from the mother's side, and I go, wow, how did that even come about? No, it's not. It's you get it free. It doesn't. It's gender, neutral.
Is
It's not
gender
your
neutral.
fault, from both sides. And hair loss is a more called polygenic. It comes from different factors that is inherited, but it's not a very straightforward inheritance.
Got it.
And then one of the common myths is that wearing hats will cause hair loss. It doesn't. It
It
has nothing
doesn't.
to do with that. Now there are things that will cause hair loss. Just having a braid, for instance, does not necessarily cause hair loss. But if the braids are tight, you get something
Right.
called traction alopecia. So just do it properly. And then the biggest myth would be people telling you that if you have hair loss, just live with it. There's nothing you can do about it.
Nothing
Of
to
course,
do.
that's not the case. We think the majority of hair loss can be completely addressed effectively too. And
Okay. So let
yeah.
let me look for your trouble a little bit. What do you think about vitamins and hair
Oh,
loss?
vitamins. Okay, so
Yes.
vitamins are helpful generally, not just for hair loss, just for general health, right? So we'll never
For
ask
hair loss
somebody not.
specifically.
Don't get me in trouble now with the
That's
vitamin
why
loving
I'm
people.
trying to get you in trouble.
So,
I get
um,
this question every day, so I'm gonna throw it to you so that you get into trouble.
okay, the drones are coming now. So yeah, if you have specific vitamin deficiencies, all right, you know, because these days the craze is about biotin. Everybody is on biotin, as if biotin is the next is the biggest thing to bread. No, if you do not have a vitamin deficiency, then a lot of the vitamins are not necessarily the solution to your situation. You do need to have supplements, especially if your nutrition doesn't provide enough. And then, slightly, just your vitamin level needs to stay within normal, not excessive. So a lot of the supplements you have, they just rely on biotin, and that's it. The body doesn't work that way. And often, if you have a vitamin deficiency, hair loss is not the only thing you will have. You probably will have other symptoms that go with it. And that's why you really need to see a doctor to make that kind of determination. But having said that, though, inflammation generally is somehow, it's one of those things that is lurking in the background of hair loss. And some of those vitamins will help with that, the antioxidants, stress, your vitamin E, um, you know, it's a powerful antioxidant, and some of the vitamin B6, vitamin B5, those all help with inflammation, stress, antioxidant, the contributors as antioxidants. That is not bad for hair, but it's not necessarily something you
It's
must
not
do
specific.
to prevent hair
Got it.
loss. You need to get to the cause of your hair loss. If your hair loss is
Oh,
caused by hormonal situation, which is what happens with most men,
Mm,
using vitamins alone will not help. That can support if you are on something called dutasteride or finasteride or one of those,
mm,
or even the botanical phytoactive
mm,
HD blocker, which I am into. In fact, I have a product line that I've developed, which is well researched over
I
several
see.
years, that I use in my practice to
Mm,
treat hair loss, not just
Alice.
AGA, but even patients with scarring alopecia because of the
Mm,
anti-inflammatory effect. And we've even published some medical, peer-reviewed medical journal publications that shows how effective it is in some conditions that were considered, even with the pharmaceuticals, difficult to treat. So these are botanicals, and they are based on phytoactive extracts, and then with vitamins to support. But the idea of just loading up on vitamins and expecting that to resolve a hair loss is not going to work. Be that as
mm,
it may, I tell people to approach the use of all the supplements with care. Obviously, you
mhm.
should go with what your doctor says and don't just go pick something up and start
Pick
loading up
something.
on it. Consult your
Okay, well
doctor.
answered. I mean, you played it really safe. I like that. But I like you. I like the answer. I do. I really do like the answer. So it really doesn't matter. Like you need proper diagnosis. That's what the person really needs.
Yeah.
Proper proper diagnosis, correct. So we're gonna go into the UGraph Zeus machine. I'm gonna be a little bit biased because I use it. So tell me, how did this machine, this beautiful machine, how did it come into play? Like,
Well, that's one thing I've not touched on is how I got into the field, even in dermatology, because I was
okay,
losing hair. I happen to be somebody who when I see a problem, I want to get involved in it, and that's how I got involved in all
me
this
too.
stuff, variety of
Yeah,
painkillers, hair, all that.
yeah,
And at that point, again, my hair, I'm Nigerian American. My hair is curled and textured,
yeah.
and I needed FUE, and there was no solution to that at that
Mm,
point. So I got involved in that. I was actually going into cosmetic surgery. That was my practice. But I
okay.
completely stopped that and devoted my attention to
So you saw the
working on that.
problem and
So
you said, I'm gonna tackle it.
I'm going to be involved in it. I wasn't sure where it was leading at the time. So we got involved, and pretty much within the first
Mm,
few months of seeing what was the state of the art,
mm. So I think he's frozen. This connection is a little bit. Let me add him again. So let me add him again. Sorry, guys, we're having a good discussion. So I'm going to add him again so that he can come right in. So the question was how he got into, because he has this great machine for FUE hair transplant procedures. Actually, I use it in my clinic. So he's actually the founder, inventor, everything, the Zeus machine. So I was asking him how it came about before he went off. So hopefully he can come back right in. Okay, got it. Thank you so
you're
much.
not going to believe it. My battery died. Can you hear me now?
Sorry.
That's okay.
Mhm.
So, yeah. So why did I stop though? I
You were
don't.
talking about how the Zeus machine came about. You said you were losing hair, and
Yes.
after a couple of months, you were trying to do cosmetic. Um, you were trying to go into cosmetics, but you found that because you had the issue baldness. So you wanted to.
Yeah. So we got involved in that, and then within a couple of months, I started developing ideas after seeing what the state of the art was, and I designed some punches that were considered quite unique and crazy at the time.
Mhm.
Then I got had some engineers to make prototypes for me, which I used in a very primitive way. And to my surprise and really shock, it made the big difference. Not only was it working on Afro hair, it was
Mhm.
working on body hair and everything, just the whole issue, gambit of problems that I thought we had. So then, of course, I wasn't even aware of things called patenting and all that stuff. So we had to go into
Mm.
that with that. And it was such a long journey.
Yeah.
So it all organically came about, and it's been
Yeah.
a lesson, a lot of lessons learned in the way. We developed the U-Graph device because I realized that the punch needed to be driven in a particular way.
Mm.
So that also called for some extended amount of work. So it took years,
Mhm.
a lot of resources,
Mhm.
and that's how the Zeus came about. And as far as the name goes, Zeus is the name of my pet dog.
I knew you were going to say that. I was just waiting for you to say. I was just waiting. I'm like, I was just waiting for you to say that. But I'm like, okay, calm down.
Yeah, Zeus is a pet dog. And I just couldn't think of a better, name for it because Zeus was that patient companion that I had.
Mm.
A lot of this work entails late at night, not
Yes.
sleeping and all that, and he's always by my side watching me. Zeus will sometimes come at 3 o'clock in the morning and nudge me to come on, let's go sleep,
Oh,
kind of thing.
oh, yeah.
So that was that. And then when I looked at the way the machine worked, it has this ability to rotate and then shake, like shake the grab free.
Yeah.
Zeus has that habit. When he grabs something, he kind of shakes his head, and I
Yeah.
go, yeah, that's him. So that's it. And so we have Zeus.
So what
It's a good
sets the
name.
Zeus machine apart? What sets the machine apart from the other? I mean, there's so many machines for hair transplant, but not all machines can work on all different kind of. But what sets Zeus apart?
So yes, what sets it apart is the concept, right?
Mm,
Uh, the whole concept of FUE had to
mm,
be reimagined. I kind of back then it was just you have a sharp punch and you cut around the hair and that was it. So I had to take into account uh, in the design
mm,
very unique concepts. For instance, we're talking about skin responsive, right?
mm.
For
Yeah.
instance, okay, the technology of the day just thinks that the difficulty in FUE is all because of the crawliness of the hair. Okay, so the first aspect of my invention solved that because of
Yes.
the way the punch is shaped, and then the texturing of the punch where it's going in and actually trying to navigate, to get to the curvature of there. So that was resolved with that. But then, even with that, there was difficulty because I quickly realized that in the African the person with the textured hair,
Yeah.
we have situations where we the hair comes out very easily, and it's the curliest hair you can imagine. You understand?
Yeah.
So, and then we have situations where the person is Afro, quite all right, but the hair is
Mm-hmm.
not that curly,
No, that curly.
and I'm having the roughest day of my life trying to get it out. So it became clear that the problem was not the curliness of the hair alone. There was something else playing a role. And quickly, I realized that it is actually the skin characteristic.
The skin
So
responsiveness. Mm. Yeah.
yes, that was it. If you need to resolve that issue to have a device that can do it all.
Okay.
So that was the first breakthrough because even up to date, a lot of doctors still think that the texture is the problem, and we're now trying to re-educate people about that. So
The
it's going to take
texture.
some learning. So we discovered that the type of skin you have, if the skin is thick and firm, and the punch
Mm-hmm.
has to navigate with difficulty, that is what
Difficulty.
causes the transection. If the skin is just medium, it doesn't matter how crawly it is. If you have a punch that is as sophisticated as the U-grab punch, it will just come up quickly. So that is how we now went about trying to devise a machine that drives the punch in a way that can be adapted to the skin type. And then we had to now come up with a whole classification system for
System,
skin
yeah.
types. And then what that now resulted to, which is really is something I'm very happy about,
Mm-hmm.
is that it's now leading to a situation where we don't characterize people by race anymore.
So there's no, so the machine is not racist.
No, no, the machine is not racist. It doesn't care about your race because we realize that you could be,
Yeah.
you could be white and still have this problem.
Problem, right.
Especially patients of like North African, Middle Eastern, Southern Europe. Some of them have the same type of skin issues or skin condition
Yeah.
that makes it difficult to get the hair with a lot of
Mm-hmm.
hair transections. So the
Mm-hmm.
classification is based on your hair biology, your skin biology, actually. So we have
Mm-hmm.
different types of skin thickness and all that, and
Yeah, yeah.
completely ignores the person's nationality or race. That doesn't make sense because these are all things that we created ourselves, you know. And
Okay.
if you say somebody's Afro, what does that mean? Because even that, you have a wide spectrum. You know, if you
Mm-hmm.
go to Nigeria, there are different types of, you know, people have different hairs, and
Yeah.
so it doesn't
Different.
it cuts across that. And it speaks to one thing. It's a kind of philosophical, in my opinion, doing science and following things. If you
It's frozen again. So maybe where he is. Yeah, he told me about his network situation, his connection situation before we started. So I was kind of expecting this. So let me add him again. So his phone, hopefully his phone is charged. So hello everyone. For people that are just joining, this is Dr. Chefu, Dr. E, owner of Havila Hair Restoration, Hair Transplant and Aesthetic Center. We do everything about hair loss, hair transplant, everything about hair restoration. So with me online, that just went off, disconnected, is Dr. Umar, the owner of Dr. UN Skin Clinic, and also the inventor of the Zeus machine. So I was talking to him. So we spoke about all his invention, projects, research, features on Dr. Pimple Poppers. We talked about that. And I mean, he spoke about all his everything he's done so far. And so happy he was able to join me today. So let me see if I can add him again. And if he doesn't join, that's also okay. You're back again. Is it your charger this time or is just the network?
yeah, it's run out of power,
Got it.
so it's on a charger now.
It's on the
Hopefully,
charger
we're
now.
able
Okay,
to
good.
finish before it does
Yes,
something.
hopefully we'll try and finish on time. So we talked about the Zeus. You were talking about that, and you were talking about, it doesn't really matter. It's not racist. So it talked it more about the skin responsiveness. If it's thick, what
Yes.
kind of type of skin you have. That's what you were just talking about in general.
Correct. Yes. So
Yes.
that's it. Now we have a universal FEU classification system,
Yeah.
which is published in a peer-reviewed medical journal that I encourage all hair transplant doctors to this. It doesn't matter
Mhm.
whether you're using the Zeus or not. Frankly, it
Yeah.
just helps you determine. The idea is for you to know when you have a patient that walks in, for you to know if this patient is going to be a challenge for you. Because what often happens when we talk about hair trans FU disasters, where patients get scarring and depletion
Hmm.
because the doctor is having a lot of transactions, it's because they
Hmm.
didn't expect it to be difficult. They go in thinking it's going to be easy, especially if
Easy.
the patient is not Afro, so they think it's easy.
It's
And then they
easy.
go in there, and then they're having a difficult time, and they're having high transactions, and they just
Hmm.
pull through, and the
Hmm.
patient receives the short end of the stick. That's because they're realizing it too late. But if they are to go by this classification system, they will be able to detect this type of patients, either to not do the surgery or at least get an equipment that will help them do that. And right now, incidentally, what happens is that the system is designed to
So he's disconnected again. I think he's disconnected again. So let's see. We'll try and wrap it up real fast so that we don't keep having these interruptions. I just have like a question or two to ask him, then we can wrap up. But I do understand things happen, so let's give him some grace. He really does a lot with hair loss that I really have a lot of questions I need to ask him. It was so maybe now I can talking with my video. So I was like, maybe we need to have a part two of this interview so that
yeah.
can really
Yeah, I'm
have this
really
discussion.
sorry about the battery and charging thing. I just realized it.
It's okay.
But yeah, I would like us to do this, and I might want to invite you to my podcast so we can,
Thank you.
do collaborate on that as well.
That's right. That's right. Okay. So, but I wanted to, because I know you do a lot with hair loss, so I really wanted to get all these questions out about AKN, which is acne keloidalis, okay? I see a lot on Instagram what you do. I'm really impressed with what you do. I think that should be like a TV series. I mean, it's more than Instagram.
Actually, we're like I said, we've started. We're working on a docu series for it,
Okay.
and the first episode should come out either next month.
Awesome.
Yeah, most
On what
likely
TV
next.
on what TV station is it gonna be?
No, it's just a docu series. We're just gonna put it on
Oh,
YouTube for now.
docu-series. Okay, okay, okay. Got it. Okay, got it. Or maybe it needs to be on also YouTube too.
Yes, so it will go into more in depth into the patients, their lives, and how AKN affects them, and then it will show some of those complicated cases because people are not aware that this problem is really pervasive. A lot of patients are suffering from it. And it's not just AKN; it's also folliculitis decalvans. We also have
Okay,
dissecting cellulitis, which
okay,
is an equal opportunity offender. You froze for a second.
okay. Can you hear me?
Yes, I can hear you.
Okay, good. So now, okay, let's leave all that. I know we've heard a lot, and I don't want you to keep disconnecting. So how do you balance all this? All your work, traveling, clinic. How do you balance? Like, how do you get time to relax?
Well, it's all in how
Like
you approach
balance.
what you do, balance. First of all, I would say you have to love what you do, right? So you
That's
have
right.
to have passion for what you do. And if you do that, it's not work. You're doing what you enjoy. So
Mm-hmm.
there's not much to it. I'm relaxed as I do my thing. I'm not, feeling any stressed. I meet beautiful, traveling is never a bad thing. You travel, you
Yes, yes. I mean,
expand your mind, you enjoy the world and you meet
new
interesting
people.
people.
Yeah,
There's no substitute for that. And you're doing while doing something you really love. So yeah,
that's right.
that's it. So I have that Zen approach to life. I don't stress over what I do because
Don't
I love
stress
what I
about. That's good. Oh, that's good. Okay, now how can people connect with you? I want people to be able to connect with you, find you, or connect with you. How can they find you?
Yeah, well, so I have my office is in Los Angeles, easy to find. Just Google my name, Sanusi Umar, Dr. U or Bumpinator, it will come up. I do have a website, dru.com, very easy to remember.
Mhm.
And then I have Instagram accounts, so Dr. Sanusi Umar, that also works. And I have a team, a dedicated social media team that's quite responsive. So if you
Yeah.
reach out me through there or TikTok, they will be sure to channel it to the clinic, so we can
Mhm.
ultimately.
So there's nowhere to hide. They can find you anywhere.
Or my phone rings randomly, on my cell phone, and I go, man, I'm about to board a plane. How did you even get this number? But then, it's there. You can find it. But it's all good. It's all good.
Yeah, no. I just wanted to talk about just one more thing before I leave you about your work with ISHRS, the
Yes.
International Society of Hair Restorative Surgeons. And so, can you just briefly one line, like, what you do in ISHRS? And I know I've seen your impact in that, so you don't need to explain to me, just more for my audience, like, because I
So the
try to preach
ICHR is
about that.
the International Society of Hair Restoration, which is a global society of doctors that are interested that perform hair restoration surgery, to be
Mhm.
specific. I also have an organization that I created. It's called Los Angeles Hair Restoration Courses. That's probably what you have in mind. So that is something I created probably about 8 years ago. And, I created that because I realized that we needed a forum that will enable the expression of ideas, people with unique out of the box ideas or even in the box ideas that can be, a forum where you can come up with questions that you have. If you're in practice, sometimes you run into patients, you don't know what to do. You go to that forum and we're there to answer it. There wasn't anything like that until we created this organization. It's on WhatsApp, and doctors are finding it to be a very valuable resource because
Mhm.
often we'll have a doctor who patient is on the table, and he or she runs into this situation and they post on the on the site, "Hey, what do I do
Yeah,
here?"
yeah.
And there are doctors jump in and they help. So that's the thing, because hair restoration itself is not, it's not, how do I say it? It's not a medical, it's not a field that is recognized as its own freestanding field. It's just an aspect of dermatology, you know,
Mm.
uh,
Yeah.
or plastic surgery. So it's not, we don't have those types of resources and we had to create them. So that's how we
Creamy
created
then.
the lots
That's
of
right. That's right.
restoration. And we also work with the International Society of Hair Restoration Surgery. It's a big resource. It's the
Mhm.
biggest organization. But this Los Angeles Hair Restoration, it occupies a niche that
That's
that
right.
a lot of
Mhm.
doctors are finding to be very valuable. I think
Okay.
I just recently added you to the group, so
Yes, you did. You did.
I
Let
was
me
I was
tell you
surprised.
something.
I was surprised when I realized you were not in the group. I thought you've been in the
Yeah,
group all
you
this
just
time.
added
So
me. Let me tell you something there.
yeah,
So I, you know, hair loss, hair restorative procedures, and people that have regained their hair. I do like an event, a hair loss exhibition show every September, and I would like to invite you, your company, like because I want to invite physicians to showcase what they are doing. Like there's a lot of shows about hair, but there's not really anything about hair loss to show the journey of people, so that people can actually see what we do.
exactly. That's
Yes,
yeah. You've actually just hit on the point I just made.
yeah.
So it's you don't
So
have these resources, and it's good for
we don't
somebody
have.
like you to realize that void
Mm,
and
no,
fulfill
we
it.
didn't.
A lot of
Yeah.
people have hair loss and they don't know what to do, where to go, and all
They
that stuff.
don't know what to do. They don't even see it. Like once they see it online, they think it's like a joke. It can happen for them. So
Yeah.
the hair loss exhibition, we had the first one last year, September. So we're gonna have another one this September. Hopefully, so I'm gonna reach out to your team, and I'm reaching out to all the doctors too. They're interested. So I want people to really know what is possible out there, what we can do. So
Where
and
is it?
we have
Where is it held normally?
it's going to be held in Peachtree City, Georgia.
Okay.
So likely we're going to, yes, Peachtree. So we're looking for a bigger hall that's going to contain more people. So that's what we're in the process of doing this year. So, because I really want people to know what is really out there for them, like, what is possible. Because I go for all these events, I'm like, no, this is not really the problem. The issue is there's hair loss going on, no matter how you try to cover it.
And
So
do you find that does it cater more to a certain demographics, or it's just everybody's there? Is it
what do
more?
you mean? No,
Uh,
everybody's there. It doesn't know specific demographics. No, everybody's there. Everybody's there. We also sometimes we do trial. We do some. If you have any treatment in your office that you want people to a new innovation that you want people. So we have like a specific hour, like 30 minutes, for anyone to showcase any treatment. Like we can
yeah.
showcase scalp micropigmentation. We've done TED hair restoration. Mike. So whichever treatment you think people will benefit that you know. So we can give you 30 minutes. That's why it's the hair loss exhibition show. So people come in and kind of watch people that have regained their hair. And also we have like a 30 minutes or 1 hour slot for people, any clinic that wants to showcase what they do.
Okay, got it. I will
Okay.
look for more information on that, and we can discuss it later.
I will. Okay. Okay. Thank you so much, Dr. Umar. I'll let you go. And I know if there's anything you want to part of me, Umar, I'm going to say for me, the reach out to my audience is going to send me a message, part of the perspective. I'll probably reach out and message something about the love. Thank you so much. And enjoy your trip, enjoy your flight, enjoy your stay and your experience.
Thank you so much for having me on your show. It's been a pleasure, and
Thank you.
see you later. Take care.
Bye. Bye-bye.